Hello, this is Dr. DJ LaDrew from Full Potential Chiropractic, and I wanted to give you a couple self-home massage tips to help you with symptoms that you may be suffering, like headaches or nausea or dizziness, ringing in the ears, even numbness, tingling, shooting pains that can go down the arm can be a result of trigger points in these muscles. And the two muscles that we're going to work on today are the SCM muscle, the sternocleidomastoid, and the scalenes. So the SCM muscle is, if you turn your head and rotate away, you're going to see this muscle pop out. That's called the SCM. So what I recommend you do is you come in here and you just take your index and forefinger and you pinch on there, or sorry, your index and your thumb, and then you're going to turn your head back towards that side. And what you'll feel as you come along, you're going to feel little trigger point areas, little tender spots, and oftentimes they'll recreate the symptoms that you're having. So if you're suffering from headaches, you push on that spot, you'll feel that headache kind of come right through your eye. So what you do is you just come on that muscle and you're going to pinch and hold that trigger point for 30 seconds to a minute. And you might do that 3 or 4 times just to help release that muscle. Another thing you can do is actually strip the muscle. You may want to use some coconut oil, or even just the oils of your skin are typically okay. But you'll grab onto that muscle, you're going to turn back, and then all you do is lean, laterally flex your head or rotate your ear to your shoulder on that side. Okay, so you're just going to strip that muscle. You just do that 3 to 5 times, and you might do that a few times through just to release that muscle. Okay, and oftentimes by doing that, I recommend you do it every day at home. It's going to alleviate a lot of those headache symptoms, and you'll find you might get rid of those headaches on your own. Next thing you want to do is find the scalene muscles. So the scalene muscles, if you feel that SCM, they're come right in behind that. So you can either use a thumb or your fingers in on those muscles, but you come right in behind here. You're going to rotate back, and you're just going to work your way down along the front of those muscles there. And you'll oftentimes come to a spot that's tender and sore, and then you're just going to put pressure on that spot. Okay, now you got to make sure that you watch out for some blood vessels in there, your carotid artery, and some of the nerves actually you can go over. That can be uncomfortable. So if it feels really uncomfortable, stop. Or if it's not recreating the symptoms that you're already feeling, I would just stop that and maybe ask one of us in the office. So you can kind of come all the way from the front of your trap here and work your way along your collarbone. You'll find spots in here that oftentimes you'll have a trigger point, and you just work on that. So you just put straight pressure, or you can actually lean away and just strip that again, just like we did the SCM. Okay, so you can kind of work on that muscle. So by doing that every day, oftentimes you can help get rid of your headaches or even numbness, tingling, or different symptoms, as we mentioned. It can make a big difference for you. So something I recommend you try at home. If you have any questions or problems with it, please feel free to ask. Leave us a message in the comment box, or shoot us an email, or come into the office. We'd be happy to answer any questions and help you find those muscles or the trigger points if you're having any concern about it. Hope that helps. Have a wonderful day.